Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you our now weekly update on the pandemic. Well, from the national news, you see that the Omicron variant has spread dramatically quickly throughout the entire country, and now epidemiologists are saying that the country has hit its Omicron peak. Now, the numbers that are being reported for the number of people who are positive with the virus are a dramatic underestimate of the true number. And why is that? It's because many people out there are infected with the virus, but either have no symptoms or mild symptoms, so they are not being tested. Now that, from one perspective, is a good thing, because if that many people are infected, then the number of people remaining who are not immune will become, and has probably become, very low. And in fact, the experts are saying that the number of people newly becoming positive with the infection will start dropping rapidly, probably over the next few days. And that's good news for us. What the experts cannot say is, will there be a new variant that pops up somewhere across the world that is resistant to the vaccines that we have in the United States of America, such that we might get another wave? We don't know that, so it's not worth discussing at this point. A reminder to people that the best way to stop a new variant is to get everybody immunized. So the World Health Organization is working hard to try to get other nations vaccinated, especially those in the African continent. And we Americans need to continue to look people in the eye who have not been vaccinated and implore them to get vaccinated. Then what will happen is the COVID-19 virus will continue to exist in our environment, but since most people will be protected against it, it will just pop up in random cases. And generally, people who have been immunized will either not get any symptoms, or it will start to look like the cold. It'll start to look like the annual influenza outbreaks, where we immunize people. We hope that we're immunizing them against the strain that eventually hits the United States, but we know that we're going to have some sick people. And we also know that immunocompromised people and the elderly will be the people most at risk. Now let's talk for a moment about children. As you know, I'm a pediatrician. I've immunized a lot of children against a lot of diseases. Babies now being born will eventually need to be vaccinated against COVID-19, or if we let things go on for a number of years, we would wind up with a new big group of humans that are not protected against COVID-19, such that when there was a flare-up of the infection, it could spread rapidly. So we will need a plan to immunize folks well into the future. As you know, children on average do not get very sick with the virus. That's not to say that there aren't sick children in children's hospitals across the country. There are, but they are a relatively small percentage. So here too, the message should be, make sure that everybody 5 and up gets fully vaccinated against COVID-19. Now, I know that parents are living through the pandemic and trying to deal with various rules and regulations of various school systems and school districts We would be better off if we had a consistent, at least statewide approach, and each school system wasn't coming up with their own rules. But given the situation as it is, if your children have been vaccinated, send them to school, have them wear their masks, and have them wash their hands frequently. The probability of them getting seriously ill with COVID if they have been vaccinated is very low. So I believe it is correct to send children to school. I wish that each school required vaccination prior to allowing children into the building. It doesn't really make much sense to allow unvaccinated children in if we're still concerned about the risk of COVID-19. At GBMC today, we have 76 COVID-19 positive patients in the building. We have 12 in the intensive care unit. We've had 2 more deaths since I last spoke with you, and both individuals were not immunized. Of the 12 patients in the ICU this morning, 2 have been immunized. So these are breakthrough infections. It's very sad, but again, individuals who are immunocompromised, who have chronic disease, or are elders are still going to be at higher risk than the average person for getting COVID-19 and getting very sick with it. And Maryland has roughly 3,400 people in all of the acute care hospitals. We will now expect that that number starts to drop. It will not drop as precipitously as the number of new people getting the infection. And the reason for that is once you get COVID-19 to the point where you're so sick you need to be in the hospital, it takes you a while to successfully recover from COVID-19, assuming you don't get sicker and wind up in the intensive care unit. So don't expect the number of people hospitalized to drop dramatically, but we should start to see the number of positive tests drop, and in fact we are, and the rate of test positivity will also drop as well. That won't drop as quickly because as the man on the street starts to get the sense that maybe they don't need to be tested just to prove that they don't have the disease and they are not sick, you leave in the population of people getting tested a higher percentage of people who are actually sick. So I hope that has been helpful. As usual, I want to thank the healthcare providers, not only at GBMC, but all healthcare providers for standing up against the pandemic. I want to thank you for getting immunized, for wearing your mask, for washing your hands, and for staying socially distant, especially when you are indoors with people whose vaccination status you do not know. Please be safe. We are here at GBMC if you need us.